I will introduce today's forum. This is the next edition of the EIOC Patient Advocacy Forum, and our theme for today is counteracting negative stress and enhancing your sense of peace and balance. I absolutely love this title. I don't know, Cynthia, where you came up with this title, but I really feel there's a lot of negative stress around, and we're going to try and calm that down today and really address some of the questions that people have on the forum. We've got so many patients that are logging in right now. Some of them are patients who've just been diagnosed with cancer. Some are at the end of their treatment journey, and I can see two of my main power men online. Ayub is there. He's the guy to tell you how to exercise and power through all treatment protocols. And then you've got Gordon, who is a miracle in himself. And maybe I'll let him tell you his story maybe at the end of the session. But let me introduce Cynthia. Cynthia is a health psychologist and nutrition guru in the United States, and my partner in crime in a number of these sessions. And I'm just going to hand over to Cynthia. Cynthia, please take it away.
Okay, thank you so much. I'm so happy to be back here for another forum and with Dr. Shahina and my partner as well. What we do, what I think is so important is not only we're disseminating information, but we learn from you. And I always like to say that because every time I'm talking to patients, I learn so much too. And then hopefully I can then convey that when I talk to more patients. And so that's why I'm so glad we do a forum like this where you can speak up. So please feel free. I'm just going to do a very short little presentation just to kind of get us going, but feel free to share your story. And give us your method, your ideas, or ask questions. We're here to answer questions and try to be more specific for your case too. And I'm hoping that some of what I offer isn't just general, like nice ideas to hear. Like even the title kind of makes you feel good, you know, but I don't want to just do that. I want to make sure that I'm getting practical with you too, because sometimes you could leave a forum like this and realize that all sounded great, but in my life, what do I do? Here I am feeling stressed, or here I am having a hard time. You're talking to yourself. You may not know it, but you're saying, I got this, or you're saying, I don't think I can do this, or I'm having a hard time. And this is how we're going to try to answer that today. So I think I can go ahead and share screen and start with my first slide. There we go. So like we said, this is about counteracting negative stress, which I'm going to explain in just a second, and enhancing your sense of peace and balance. Why did I choose peace and balance? Because when I'm in conversation with patients, those are the two things I hear everyone seeking. Of course, they're seeking health, but virtually for themselves, they need a sense both physically and mentally of peace and also balance. And I'm starting right away to say, look, hydration can give you both physical and psychological side effects. So overall, if I were going to say whether you're in the beginning, the end of your journey, chemo or not, radiation, surgery, wherever you are, if you're not paying attention to hydration, that could even be giving you some of your mental symptoms of just not feeling well, feeling foggy, feeling confused, feeling fatigued, and then physical too. If, for example, constipated or painful, or there's so many things that go hand in hand. So I just wanted to put that up there first. And then after that, look at that pencil. Have you not been there with the stress? I'm sure you have. There's a difference between good and bad stress. So good stress is stress where it's part of life. You're being asked to do something or change, but you have control. Like you can do it. You can meet the bus at a different time, or you can make it to this meeting, you know, at a different time, change your schedule to get here. That's actually good stress. We have it every day in life. But distress is the stress we have less control over. So knowing the difference, watching yourself, like how are you reacting? Is it you overreacting a little? Is it really becoming hard for you? Benefits of stress. You probably have a big question like, really? There's a benefit of negative stress? There is, because first of all, it gets your awareness. You wouldn't know that something's off kilter, out of balance. Secondly, it can be a great motivator, capital M there, because we all need that extra little motivation. And thirdly, when you overcome negative stress, which you will, You have self-efficacy. Then you have a track record and you realize I did it and I can do it again. And so that's a benefit of going through stress. This is one of the many styles of coping. We all cope differently. We don't need to conform to each other or be cookie cutter in coping. Many people have their own way of coping. This one is called fighting spirit. It just happens to come from one of the scales out there in the research, but this is what patients will say for that one. I take one moment at the time, one day at a time. I see my problems as a challenge. I'm determined to beat this. That's one way of coping. Not everybody fits that, but I just wanted to show you that these are the kinds of things you might be saying to yourself. And we'll talk about other forms of coping today too. On balance, these are the things where we really have to get used to even ambiguity. Okay, so we need active involvement in our diagnosis and our treatment, but not taking over and ignoring the guidance we're given either. We need a good balance of both. We need a shared experience with other people, but it's not all about other people. We also need to pay attention to our needs and not everyone else's need. We need information, but not an overload of information from the internet where now you've completely confused yourself, right? Which can happen. We have positive and negative stress. We need a balance there. With movement, you need movement, but not over exercising to the point of fatigue. Meditative movement, which is really important, goes along with breath work and meditation, but not at the expense of doing normal life too, right? And then this rhythm idea. Like a lot of people will listen to music, but also you have a rhythm in your body when you start to move and do meditative movement. There's a rhythm in your life too. And I find a lot of patients, part of what they're going through is to get back to both physical and psychological rhythm, like who I am, how I used to be, how I knew myself. Okay. These are some characteristics of the survivor personality because we just love to see, well, who's doing well and how and why and what are these people like? Well, they're usually pretty flexible. And if you're not naturally flexible, don't worry, you can learn to be. That's not a problem. They can still find humor. They have a need for harmony, for feeling like they're in sync with something or others in their world. Typically have empathy for others and have a little intuition too. Like they'll say, I kind of know myself, or I know my body, or I knew this might be happening, or I have a feeling or a hunch this is what I should do here and reach out to this person. Playful curiosities are really cool. And I'd love to hear your stories on playful curiosity. This is where people get back into life and say, like, I'm just very curious about this idea, that doing some sort of craft work can actually help my mind and my mental fog. I want to just try it. I don't know if I believe it or not, but I am at least going to try. And then serendipity is a belief that all the circumstances in your life could lend toward something good, toward a positive outcome. That serendipitously they can all come together for your favor. So just a couple more. This one is saying that in the end, I'm always amazed and happy to hear patients say, either way, how difficult it was or wasn't, I found benefits. It brought me closer to my family. I understand myself better. I can feel the priorities in life. I can tolerate when things are good but not so good. I'm okay. I'm not sweating the small stuff, as they say. There's a lot that goes on when you start to really feel like you're in a bigger meta view of the purpose of your life and that all of this experience with cancer can fit in. Okay. Now, after that, I have several slides on some of the physical side effects like nausea, constipation, lack of appetite. So I'm going to save those in case somebody in the audience says, specifically, I'm dealing with nausea. I really need some hints or tips and come back to those because those are more just practical ideas. So I think I'll stop there and wow, we filled up. So I love it seeing so many people and we're ready to hear from you and take your questions when Dr. Shahina is in charge, whatever she says.
No, so please put your hand up and we'll unmute you so you can ask your questions directly. And if you want, you can post your questions on the chat. You said something very, very interesting, Cynthia, and that is, people trying to get back to normality and really thinking about how I used to be and trying to, be back to that point, is that what they really should be doing, or should they be thinking about growing in a different direction post their whole journey? Should they really be going back to point A, or being a better person after that? You know what I'm trying to say here?
I do know, and I'm beaming because it's my favorite question about that topic because it incorporates both. And I also, I know when we first started doing a lot of this kind of work in cancer, we were saying you're going to have a new normality, you're going to get growth. And someone in their late 70s, 80s saying, I didn't know I could still grow. But part of the growth I have found, and this is just from my observation and listening to patients, is a reconnection because many patients feel like they've lost the core. So I'm really talking about the core part of themselves, not necessarily that they're still in all their outward activities and everything, but they need to connect to that core. Like, like I have a sense of the world as a place where I belong. That's a very core feeling for someone. And if after cancer, they don't feel that, some people feel completely uprooted and ungrounded, like, I don't know where I belong in the world anymore. I don't know who I am anymore. I don't know what I am to other people. I felt like I got victimized. I had someone yesterday, I've never even been sick. I don't understand. I can't relate to myself as a person with an illness. And so that's where I mean, connect back for the normality of the core, you and the world, with growth, though, with layers of growth, always changing and growing for sure.
So one of the things that I notice amongst patients, and obviously this is something probably a lot of patients are dealing with, is that during that journey, there's a lot of negative stress. Some people take it very positive and they go through that journey with a positive attitude, and they know that there's nothing else they can do about it, but actually just sort of incorporate it into their lives. But there are other patients, at every week that I see them, I feel like they're not coping the way that it's sort of breaking them down internally. So what sort of tools can we perhaps use in that sort of a situation to try and help these patients come out of that? What can they do in that sort of a situation?
So important. And I think the first most fundamental thing is knowing that about themselves, like just one or two questions, statements. You're feeling very stressed. Are you feeling unable to really cope with this and deal with this? Because some people will hit a point of denial there, which just makes it worse. So acknowledgement and acceptance, I'm in an uncomfortable place. And after that, knowing that that's par for the course for many people, so they're not alone. And that's where that shared experience I mentioned comes in. I think it's very important, even if it's just one other cancer patient, which there are many sites out there, they'll hook you up with somebody who is like you as far as a similar diagnosis, or if it's in a group setting. But you need a place where you can express how you feel. And if you really cannot or will not, or it's just not right for you to be in a group, there are ways to do expression on your own. You can draw, you can write, there are lots of ways to get the expression, do vision boards. There's so many things, but you have to acknowledge and accept that you're really having a hard time. Find a way to reach out and connect and speak with other people, either in a group or one-on-one, and then start to say to yourself, what will soothe me? What will soothe me? What's wrong? What would make me feel better? And those are very fundamental, even in one-on-one counseling. What's missing? What am I missing? And what can I do about it? How can I make myself feel better? Or start looking in your life. At what point, at any point at all in the day, do you actually feel a little peaceful? Why? What are you doing there? So it's getting right back to the fundamentals.
So we have a couple of questions on the chat box. Wissam asks, is there an established connection between cancer and bad stress? And I think this is a very important question because a lot of my patients come and ask me, did I get this cancer because I'm so stressed at work all the time, or my family life is just so stressful? Could this have triggered the cancer happening? What are your thoughts here?
Yeah, so this has been a long-standing, very difficult to study research question, as everyone I'm sure could imagine. But There is an association in story. So when many people could tell you their story, they can even say, I just went through a difficult divorce, or I just took care of my elderly mom for a year, or I just lost my job, or, they'll find some stress and relate it to it being associated in time with their diagnosis. Also, in the literature, we do know that mental distress, so we're going for distress especially, that's prolonged, like chronic stress that's difficult for you, does produce more cortisol, more inflammation, things like that that are biological in your body. As a direct cause or a strong reinforcer for cancer, that's a yes and a no. We really haven't been able to pin it down in a one-on-one direct way, only because there are so many other factors involved with cancer. So could it be part of the issue? Possible. But could you have done something differently so it wouldn't? No, it's not like that. It's just, unfortunately, we're not in a place, I guess, where we can say, if only I had coped better or seen it better or nurtured myself better or spoke up more, or I wouldn't have gotten cancer. That answer is a definite no.
So then Nita asks the question, how do I help myself to overcome the guilt feeling of giving unnecessary stress to my immediate family, especially to my young daughter? I'm still struggling emotionally to come out of the guilt even after a full recovery 2.5 years later. And I think this is such an important question because Nita's not the only one who's experiencing this. I've seen this amongst other patients where especially in our culture here in, at least in my part of the world, there seems to be this sense of I don't want to burden anyone else, despite the family really wanting to support them. They feel like they don't want to be the burden. They want from being the leader of the family, they suddenly become a person that everybody else has to support because they were supporting everyone else. So
Mhm.
how do you deal with that?
That's such an important question. We used to think years ago that that was part of being a cancer patient, is you were a person who was always there for other people to your own expense. But that was too simplistic. That's not causing cancer. But what's happening is making it really difficult to take care of yourself and go through something like cancer, trying to protect everyone around you, or even just trying to take care of the other people around you. So it's a hardcore answer, and it's a really hard, direct look at responsibility. Are we responsible for those individuals? Are we our brother's keeper, basically? Is the mom responsible for the children? Yes, of course we are. That's why we have these relationships. We willingly take on responsibility that we're influencing other people. However, I'm going to say with limits. So there's such a thing as knowing the limits of your responsibility. Now, I know everyone who's listening and has that problem or that issue or has gone through that is saying, oh, I would never be under responsible, and you wouldn't. Most people would never knowingly be under responsible. But over responsible, we do it all the time, where we think that our sorrow or our difficult time or our concern or our worry has now spilled over on other people, when in reality, they're sharing it as much as you're sharing in that direction. So you don't need to hide it, but it shows them that you're human, especially if it's a child, depending on the age, of course, how much you share and how much they see. I think shows them this again is the reality of life. There are good and bad and things that we have to overcome in life. And together, your child and you, or whoever your other relationship is, will see your ability to meet the challenge. And I find that when we start to pose it in that light, that it's a challenge that we are going to meet. It's that we have a will to live. We love life. We want to be here. We're going to do everything we can. That together is a shared challenge. And in that way, you're not hurting the other person. And even if you thought you have, and maybe a lot of time has gone by, it's never too late to start that conversation about, I really appreciate that we shared this together. And I need to make sure that you come out on the other side as good as I am too, that we all both see the benefit and that we're closer and that we can meet the next challenge. When you can say to yourself, I did this, I could do anything now. I can do the next thing because there is going to be a next thing. And most of my survivors who have survived against all odds, that's what they say. They say they realized, wow, my track record now means I'm ready for the next one because the next challenge is going to come. So rather than sort of folding into and melting down and, oh gosh, I hurt somebody else because they had negative emotions, let's all learn to pull over those emotions, you know?
So Ayub asks a very interesting question. How does chronic stress biologically interact with cancer progression? So we have, I feel like in 2024, 2025, because 2025 just started,
Mhm.
we live a very fast-paced life, a very
Mhm.
stressful life. We have work pressures, we have family pressures, we have pressure, just interacting with everything around us. And then you've got the cancer that's right on top of that. It's another layer of stress. Whether we like it or not, it's another layer of stress. It's another battle that we have to, go through. And even though you have family support, it's usually you're doing it alone at the end of the day. Does it
Mhm.
impact what what happens with the cancer? Because a lot of patients actually ask that question. And I think it's a very important question because, at least for me, if you're mentally at peace, you're mentally less stressed, you're more able to focus on the treatment. And that automatically makes the side effects a lot less. And at least that's the way I see it. But I want to know what your thoughts are.
So I like to, I'm just going to tweak one word in the question, can it? Because yes, it can. So does it? It's a complicated question because the biology of chronic stress is that the appropriate thing in your body happens when you're facing negative stress. Actually, your body doesn't know the difference at first. Only your mind knows the difference between distress and eustress. But your body is now kicking up the immune system, possibly through cytokines for people who have read about it. That's a good thing if you're facing a virus, but it's not a good thing if you're not facing a virus. And now you've got your immune system turned on, activated for a chronic period of time. That's what this chronic stress means. And biologically, that means you're going through an inflammatory process. That's basically what that is, just for one term over the entire process with your white count and everything. You've turned on your inflammatory process unnecessarily because you're not fighting a bacteria or disease. So, what that does to the environment of your cells, which of course I'm sure nearly everyone here knows, your cancer cells are your cells. They are your own body cells, but they happen to be gone awry. They're developing too rapidly. They're in immature states. They're growing, right? So they're becoming a cancer cell. So could that activate a cancer cell? That's where the real question lies. Can it or will it? Will it? I can't answer because it wouldn't be the same for every person or every organism. Could it? Possibly. And that's why it's so important, even on the preventative side of cancer, that we teach managing stress. Can we just get rid of stress and run away from stress? Sometimes. Sometimes you're in a rotten job and you've got a really bad boss. And if it's possible to change your job, you need to do that. But sometimes, no, you just need to learn to manage stress. And can you run away from cancer? No, that one you definitely have to manage. So now you're getting to the nitty gritty. Well, how? How can I manage stress? That's where knowledge about it, acceptance that it's happening, and then doing things to lower the inflammatory process, which, as Dr. Shahina is saying, even your mental state can lower that process. The more you meditate, do breath work, do meditative movement, even exercise. It's amazing. The data on exercise, especially now, is just blowing everyone away how much the appropriate exercise does for your circulation and lowering your inflammatory responses. So then food comes in. Eating anti-inflammatory food, avoiding foods like sugar that causes a lot of inflammation. But it's not every little piece is poisonous, or you can't get so tight with it where you must eat broccoli every day in 6 teaspoons, and it can't be so tight with it that you never put a lump of sugar in your coffee. It's not like that. It's a bigger picture, overall, holistic way of reducing your inflammation, having your mental peace and your mental ability to manage day to day to day. So I know it's a long answer, but it requires kind of broadening how we look at it. But yes, even the cancer itself can become added stress. And believe me, it is. Because what happens right away, you say, what's my timeline? Is this going to affect my timeline in life? Can I overcome this? Can I still work? Will I still be able to do my job or do my activity? Is life going to be what I want life to be? Do I have what it takes? You look at the person next to you in chemo and they look like they've lost their hair and they've lost their weight or whatever. You get scared to see that and you wonder, can I do that? So there's so many layers to this, so many layers. But it is important that every step of the way, and by the way, even after survivorship, now your life forever is going to be about managing stress.
No, I wanted to circle back to the very, 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 very important aspect of what you said, which is exercise.
Mm.
So, I mean, I think because there are a lot of people here that online that are my patients, and every time they come into my clinic, I harp on, did you do your 30 minutes of exercise? Did you walk every day? At least walk every day. And I think many of my patients get scared when they come into my office thinking, we didn't walk, we didn't do our exercise. What are we going to tell Dr. Shanina? But are there is there anything you can recommend as the minimum exercise that everybody should be doing at least during their chemo journey? Especially this is all at least for the newly diagnosed ones. And I just want to, congratulate my star patient, Ayub. He's there, his video is on. The guy is in the gym every day, pumping
Yeah,
iron and doing so,
yeah.
so well. So, yes, I mean, Cynthia, what are your thoughts here?
I feel so strongly about this. And this is just an idea. I mean, I'm going in the literature researching this all the time, talking to patients and researchers. I actually have a diagram of something called pillow exercises, okay? And pillow exercises is like 5 to 10 movements you do with your pillow. I mean, and I say to patients, if that's all you can do, please just do this. Why would I want? I'm kind of tongue in cheek, but not really, because when you take your pillow up, now you're moving your joints, right? When you get your arms above your heart level, now you have a little teeny bit of aerobic work, right? When you go side to side, when you do qigong, when you just dance around your house in a slow fashion, when you breathe and move with the breath work, any kind of advance to yoga, all of it is important. You must move. You must have some form of exercise. And believe me, they're trying to figure out, well, does it have to be this 150 minutes a week? And is that 15 to 30 minutes a day? Should it be with weight? Should it be, we can get into all the different caveats like that. And very different studies will show you different things. But for some of the cancers, I can tell you for sure, when World Health Organization looks at those who are in remission, they nearly always see, as opposed to those who haven't gotten there yet, exercise. So just knowing that alone makes me say, I'm going to find some way. And I know people who absolutely hate the idea, but they don't want to get off the couch. Patient yesterday, it was snowing, so they had trouble getting to the gym. So here they are. And I said, well, do you have things at home that you could do? Yes, but I also have a really nice couch and a TV there too. So the motivation, right? So it's the motivation. So, and you don't want to
Yeah.
scare yourself into it. You please find something you actually like. That's all I say about that. You got to find something that you actually feel better later. And even if you only feel better that you did it, that's okay too. You'll eventually find something you like. It's absolutely imperative. There's no way around this one. Sorry.
So I actually recommend to patients to get onto Amazon and buy these wristbands and ankle bands that have little weights attached to it. Not very
Mhm,
big ones, little ones.
mhm,
And then in your home, you can walk around, do your normal daily activity, wash your
mhm,
dishes, and you're
mhm,
actually moving those muscles. And I
mhm,
think that's what's needed. It's a lot of it's been proven. I know you must have read the papers for it as well, that it does reduce, it not only improves your core strength and your ability to get through the chemotherapy, but
mhm,
it also reduces adverse events associated with
mhm,
chemotherapy, namely fatigue that can
mhm,
happen with chemotherapy, as you know.
mhm.
And
Well,
actually, Yes.
Sorry, I was just going to say, in fact, right now, the only solution for fatigue from radiation is exercise. And even your blood work. If am I correct about that? They
Yes.
even have studies showing it improves. So
Yes.
not only will you feel better, but the physiological evidence of your blood work being better. I mean, and I also have patients, I say, just put a little 3 pound weight in the bathroom
Yes.
before you shower, just do a few. I have one patient who put him in her car with her, and when she gets to a stoplight, she does a couple. But so if you can just like weave this in, like you're saying, into your day, that would be great.
So Amal has asked the question, you mentioned the importance of exercise. What types of workouts are suitable for cancer patients? And again, we just mentioned some of the little things that you're doing. I know that some of my younger patients have little babies, and we have a lot of young patients here. So I tell them, put your baby in the pram and go walking in the mall. That will help you exercise. Is it
Yeah.
high intensity training recommended, even though there are studies that say it causes stress and in the body? What are your thoughts here? I mean, I don't ever recommend intensity training. That's depending on your level of, stamina, but at least some cardio every day would be really great. But Cynthia?
So I think we're finding that the high intensity is correct only for a segment of patients. So these are patients, for example, who were CrossFitters, or athletes, and they have now recuperated to the point where they're back to the ability, like you said, the stamina, the endurance, etc. Also, so for certain cancers, for example, with prostate cancer, you really a lot more intensity of resistance is needed, whether it's putting the bike on a higher resistance, high intensity that way, because there's so much muscle atrophy happening. So that, and maybe I have a feeling that we're over into the research literature with actual high intensity exercise. When you look at that, it's very interesting how the early starvation of the cell from the real high intensity, like where you do the quick circuit training and things like that, actually does seem to have some benefit for endurance, for strength, and for certain numbers, depending on the type of cancer, and for bone density as well. What we're also finding now is something called deep training, which is doing, if anyone who already has been released to do weights, if you're released for that, the deep training is where you do shorter, slower movements, like this would be a bicep curl. Not that I'm a weight trainer, but would be a bicep curl, but you just do it to fatigue, like to exhaustion of the muscle and stop. And they're finding that that deeper training is getting even better benefits for muscle tone, bone density, and if necessary, weight. So that's where the high intensity comes in. That's why it's so important to consult with someone who understands what stage of cancer and treatment you're in. It's not the same for everybody.
So then there's another question. What about sleeping routine? I mean, if our habit is to sleep in the late night after 2 a.m. and wake up late day 11 a.m., that's actually quite fantastic. I can't remember the last time I woke up at 11 a.m. I'm always out of bed really early in the morning. Is that considering to less progress the healing of cancer? What are your thoughts here?
So I've never seen any convincing evidence that you have to sleep in the segments of the day and night that we consider normal. But I have seen research that says the amount of sleep can make a very big difference. But if your cycle seems to work better, where you go to bed really in the morning, you're going to bed and then getting up, and that's not interfering with the rest of your life, I've never seen anything that indicates that that's a problem. Mm-mm.
Okay. Then there's a question, what are the naturopathic remedies you recommend for fighting cancer cells at early stages? Now, I know there's this whole fad that's going around, and I'm an oncologist at the end of the day, so I'm going to say it's a fad, but I'd love to know your thoughts about it, of using naturopathic medications to counteract, the cancer that is being diagnosed.
So it's great if that person also wants to ask me about specific items, but for a general answer, I think that two things. One, there are many things that are naturopathic because food really is just chemicals. We're already dealing with chemicals. So it could be something that like it's Ayurvedic medicine, or it could be in Chinese medicine. And one of my favorite herbal companies actually runs all three studies, Ayurvedic, Chinese, and Western. They run that type of research on everything that they promote or sell. I think that that's really important. And as far as doing it at the beginning, as long as there's no interference when you're just starting chemo and we have a known interaction or something like that. And I like the fact that the question asked me about the beginning of cancer, because this is something I haven't seen a lot of people research it, but I'm doing this over 30 years, and there's sometimes you have a feeling or a judgment about things. It seems that when the body gets a shock right away, like you suddenly eat differently, drastically differently, or exercise drastically differently in a positive way, nothing negative. This seems to really change things up. Like the body chemistry is changing out of what it was. It could be as simple as, well, I eat this much carbohydrate every day and at a time, and these sugars, etc., and I just yanked all the carbohydrates out of my diet. Well, you can't exist very long with zero, but maybe you put your body into a shock where you pulled the glycemic load down so much that it did make a healthy difference. I think that's a real possibility. So I say tread carefully with that. Just be really careful to make sure none of it is harmful, and that it shouldn't break the bank. It shouldn't be overly expensive. I've had patients come back to me and say, I decided to go and do more complementary medicine, and actually it's more expensive than the regular medicine, and I can't afford it either. It should never be like that. There's so many natural things that are available to us, even just in our food, so I think that's really important.
So there's another question. Knowing someone in the healthcare industry who has cancer and caring for someone with the same disease can be emotionally challenging, which is
Mhm.
completely correct. What
Mhm.
strategies can you use to manage your own emotional well-being while advocating for others? And I think that
Mm.
is such an important question because a lot of the survivors that we have here on the forum have also now begun to support other patients who've been
Mhm.
diagnosed with cancer. So I think it's sort of an extension of this question. How do you, and I've seen a number of my patients that have actually walked into the clinic. They're completely cured. They've been doing well for so many years. And then they connect to another patient who's just at the beginning of their journey and perhaps not doing as well. And that can be a huge emotional burden on the first patient. So
It's
how
true.
do you deal with that?
Yeah, I see that a lot. And it goes back to one thing, which is again, the limits of our responsibility. If when we're caring for another person, it's taking from us, then you'll know I'm over responsible. If otherwise you feel empowered or you feel good because of the harmony there's nothing better than having been a patient to be able to now offer to someone else, this, I did this, it helped me, or even if it wasn't what you did, I see something that can help you. That's very empowering and uplifting. And I've known a number of patients who they themselves said they thought that's what kept them in remission for so long, was being able to help other patients. But if at some point you can feel it's taking me down, it's taking from me the very same coping skills that applied to you as a patient, that apply to you throughout your life. So that's why I say, and I'm going to write this book one day, What We Learn from Cancer Patients, because what we learn as a cancer patient really applies to everybody. How to manage your own emotions, how to manage your own feelings and thoughts, make sure you're getting your rest, make sure you're eating correctly, make sure you have exercise or things that bring you a sense of peace and groundedness. So if it pulls you out of your therapy or your way of dealing in life and the lifestyle that's keeping you healthy, then something's wrong. You're giving too much or in a way that's not healthy for you. In the end, it won't be healthy for either of you. So I think that's so important. I run a caregivers group, and I'm going to talk with Dr. Shahina later. A lot of my groups, I can make duplicates at hours that are better for your time zone also, because I think these groups where people can talk and hear from one another would be really important, especially caregivers. Caregivers need a group too. They need a place to learn how to care for themselves as well.
I was just telling Cynthia I need a separate session with her just to vent out all my thoughts at some point. Um, so I wanted to ask a very important question. And that is the role of psychologists. And so basically having the psychologist, the oncologist, and the patient work together to get through some of the challenges that they go through during their chemo journey, perhaps even post chemo journey, and learning and how that can help deal with some of the adverse events that happens, because there's a lot of newer drugs out there that has different types of side effects profile, and we're learning how to cope with it in terms of managing our patients. But we tend to forget that it does impact, it has a psychological impact on patients. I've seen patients who come in and they're saying, yes, we're going to proceed, we're going to, go through this, we've got a good attitude. One side effect comes up and then they crash. So how do the three work together? And what are some of the challenges that are posed in terms of working together?
That's a great question. I think working in tandem is the way it works best. And so, but to explain specifically, it's how the patient takes it. For example, when I'm in the clinic and I'm working with a medical oncologist such as yourself, of course, we're looking at different things because you're looking at the medicine in the lab and how the patient is and how they're progressing and the protocol and all of the most important things. I'm going to say that. But there is another piece. That other piece is the experience of it. So I think sometimes we're so busy in clinic making sure the things are done, the medicine is administered, etc. But how did the patient actually feel about it? What was it like for them to go through it? How now do they feel about themselves? And then when they're at home in their quiet, private moments, what's happening there? And that's where the psychologist comes in. And psychology in cancer is not about pathology. It could be. You could have someone who has severe depression, but it's really about well psychology. It's really more about let's try to buoy this. Let's try to stay on top of this and be as much as I can healthy in my mind and body as I go. And it changes every day. You can be up one day and down one day. I had a patient yesterday, he said, I'm going backwards because I'm not doing as well today. Serious cancer, very difficult surgery, but actually he is going up and down, but his up and down is going like this. So overall, as he's experiencing, oh, now here's a side effect, and then I can't do this, and I couldn't breathe well, and then it didn't, and now I can't sleep. But it's actually, he's getting through the process, doing better. But who's really paying attention to that? That's going to be the psychologist. So sometimes in the cancer, I call myself the fourth leg on a four-legged table because I feel like there's a surgeon, a medical oncologist, a radiation oncologist, but guess what? That table is going to teeter because if you don't have the fourth person who cares about the experience the patient is having with it, then they could, like you said, they can just fall right down. They won't be able to continue treatment sometimes because of how they feel. They won't follow through on what they should be eating or the medication they should be taking. I had another patient this week. The nausea was so bad with pancreatic cancer, they wanted her to take all three nausea medications. In her world, doubling up on medication just doesn't sound right. It just didn't, even though they told her. So it took somebody saying, talk to me about that. Why does that sound so unsafe and dangerous? That you could add more medication. She thought it would kill her because why would you take three of something? See, because she's not medical. We're not medical people, patients, right? Necessarily. Then I think that answers the question, how they're even seeing things. You need someone who can take the time to help with that.
So I completely agree with you. I sometimes take a step back and I tell my team, and I don't know if they're medical oncologists actually on this forum or any physicians. Sometimes when you're prescribing all these things for patients, you have to understand that they are not medically based. These are patients where you sometimes have to break it down and say, why are we doing this? We're doing this because of this to help you along. So many important questions coming through, but I wanted to ask a question, and I personally sometimes, I feel that as a physician, I need to take a step back and actually look at it from the patient's point of view. But when a patient is newly diagnosed and needs to get into the treatment journey, there's a huge hesitancy to get into that journey because of the uncertainty around whether they should or should not be taking the treatment. If you get what I'm saying, because there's this whole concept, oh my God, chemotherapy is bad. It's a lot of it is coming from TV. I tell people they watch too much TV and too much drama. But it's this whole thing. We'd rather do surgery, we'd rather do radiation therapy, we don't want chemotherapy. So then they start shopping around, but it's not really shopping around, it's just that uncertainty, that hesitancy. What should they do rather than doing inappropriate Google searches to be able
Mhm.
to actually come to terms with the fact that they have to take a treatment that they may not agree with?
Mhm. This is a really tough one. You know, it is. It's very, very tough because you can see that patient is right there, you know, possibly saying, I'm not doing anything, which is very scary for the health practitioner to see. Excuse me, because we know that that's not going to be good. You know, they need the chemo. So often what I when I'm talking with the patient, I open it up and get their fears, that uncertainty. What are the fears? Is wild or unfounded, or often there's an experience of someone they knew that had chemo, you know, maybe it was even 20 years ago and it's not even the same now. There's so many fears. It's from TV sometimes. We've got to hear the fear. What is it that's making you hesitant? And then after that, sometimes I'll actually even say, and I think this is important, nobody in their right mind, excuse me, would just take chemo unless they had cancer, okay? Because yes, chemo could be difficult. It could cause you certain side effects. It could really make it hard for a week, a month, a long series, depending on what, you know, your treatment is. But you wouldn't do this except for the fact that you have cancer. And cancer is something that's far worse than chemo. So I really like to show that what the cancer is and what it can do to decrease the function of your organs, the function of your body. We have to do something because it will progress. So you must do it. You must weigh it out that way and know that at every step of the way, medications will be given to try to offset the side effect, to try to prevent the side effect, to quickly deal with the side effect. As long as you get in a close connection with somebody who can be there for you all the time, whether it's the nurse or someone like myself. The doctor can't be on call 24 hours a day, but you know, there is a portal where questions will eventually get answered depending on what it is. I think you have to have a hard talk in that way, that chemo is chemicals, it's medication that's been derived to specifically deal with cancer. And that's exactly why we have this. But you must do it for that reason.
So there's another question. It says, please let us know how we should respond if a family member during a heated argument says that they are going through worse than us because they have sacrificed so much on their end, and rightly so, as it has been challenging for everyone. But at the moment, you feel emotionally distressed and sad hearing it. How do we deal with such situations? And I think this is such an important question because you see that family dynamics. That in the clinic between patients and their family members want to support as much as they can. The patient doesn't want to be too much of a burden but is going through that journey, and then clashes can happen.
Mm.
And these clashes can happen even if you don't have cancer, if you're not going through the chemo journey. It's like a married couple, they're always fighting with each other, but I think the love actually blossoms when they're fighting because no one has a perfect relationship. And I sometimes tell my patients that if that fight has happened, if that argument has happened, it's those words are being said in the heat of the moment, which could have been said even if you didn't have cancer. But it's just showing that you're having a relationship and that relationship's important and you're allowed to have a fight. It's okay. But what are your thoughts over here?
The question itself is heartbreaking, isn't it? Because both people really need and both have just so much to give. And like you said, it happens in life all the time, can happen. And we can flare up, but especially if we're tired and exhausted and we're unsure of where to go, that makes it much worse. And then it's cancer. I think it's a lot harder because this isn't, a decision over the household. It's a life altering situation. I think that when that happens, it's so important to allow expression and then know we're going to talk, sit down and talk with softer voices. So if somebody is out of hand, especially, you can say, I do want to talk about this, but it has to be later because I'm heartbroken right now too. And so agree to talk later. with a neutral person or not, that's always a good thing, but it can just be you. But in a quiet moment when you've agreed to talk, really say, I want to hear now in a soft voice or lower, less extreme. I want to hear, what do you need? What are your needs? And what can I do for you? And go back and forth between each other. And there's a really good chance, I have found, that the need is the same. Both will start to say, I just need a break when I'm not thinking about cancer. I do too. How can we get that? Okay, we're going to take a walk or go to a place or watch a movie or something. It doesn't have to be cancer 24, but you'll find out that underneath all of that emotion and exasperation is need. And that's what I call kind of the underbelly. And find out, what is the need that you're not getting met? And let's together devise a way to make sure that need is met. And it can be done. So I've seen couples do all kinds of creative things to have a break here, or do something differently, or you go have some time, with your brother or your sister or your friends, or if there's a way to do it, but to just let it go on and on, it's not helpful. Sit down in calmer times, calmer voices, and find the need. Not everyone wants to talk about needs because it's emotions, but it's the need.
I
Mhm.
think that's where one shouldn't hesitate also to ask for help from a psychologist, to perhaps
Mhm.
sit you down and maybe
Mhm.
individually speak to them or even together,
Mhm.
because it's a tough time.
Mhm.
It's a tough time. Love
Mhm.
is there, the relationship is there, at least the relationship is there. And I always say fights will happen, but you need
Mhm.
to talk it through. And like you said, they need to maybe back off for a little while and then come together and discuss it and then address
Yes.
the problem for sure.
And can I just go just a little deeper, because I feel very strongly about this. A good example is the patient's husband, very, very angry. They're both angry about the cancer. The husband is angry for some decisions that his wife made, but he feels guilty and doesn't really want to put that anger on her. And she feels horrified to think that he's angry with her. That's where you need a neutral person.
Yes.
So he came into clinic and told me all about his anger toward her, got it out of his system. Then we went deeper to have empathy for her, why she may have made these decisions, acknowledging how it did hurt him also for their finances, etc. It's okay. We have to be real about what it is. And then they went together because he wasn't carrying around the double anger plus guilt for having anger. You don't want to carry that around. That's the worst, because you're not even able to express your anger because you feel guilty of it, right? So I feel very strongly that you need to see someone in those situations.
So there is another question, oral chemo drugs like aromatase inhibitors. By the way, these are not chemo drugs, these are blocking agents for hormones. Menopause inducing injections and immunotherapy can cause severe anxiety, depression, muscle pain, often worse than chemotherapy. And I completely agree. I've seen this for the last 20 years with my patients. It's not easy for, especially a young woman going
Mhm.
through, early menopause and blocking it so suddenly, making it hard to exercise, focus, or even get out of bed. Again, very real problems that women are facing, especially in their breast cancer journey. So, how do you deal with that?
See that breath? Those are some of the hardest, because they can't even put their feet on the floor. They hurt so much sometimes. Their body aches so bad. Like, and now we're saying you really need your exercise.
Yes.
So, um, on the or on the medical oncologist side, I mean, of course, I just want to say I can't address that part. I have seen doctors change the how or the level, or, but I can't address that. Like, even change which blocking agent, but I don't know on the patient, that particular patient, you'll have to see what your doctor says. But on the other side, it's acknowledging this is where it is, this is how bad it is, and it sounds like that person would be acknowledging it. And now, literally in bed, you're doing stretches before you even get up. You roll your ankles, you do this with your feet, you move around the bed, you do some stretching and breathing in the bed. You do everything you can there where you are able, because it's only worse not to move. Not moving makes you stiff. makes it worse, makes lack of circulation, makes the pain worse and the stiffness worse. So whatever you can do in bed, you'll need to do. And you have to get your mind used to small increments of change. If today you actually even sat up in the bed and you were able to stand for a moment, that's great. Tomorrow you'll stand a little longer. You have to get used to small incremental changes. Your whole mindset has to go away from the past, doesn't matter how you used to be, and get off this ideal of how I really want to be and get in today, just this present moment. This is how I can function today, bit by bit by bit. Probably a lot of, we're back to naturopathy again, a lot of good anti-inflammatory herbal agents, teas, things like that. There are rubs, even acupuncture can be helpful in this situation. So all of that, employ any of that that you can. That's not harmful.
I'd also like to put in that perhaps you need to go back to your medical oncologist, express these concerns. There are measures that you can do, like everything that Cynthia said, but I would go back to the medical oncologist, express the concerns. And sometimes what we do is we stop everything because it's okay to do so. You stop
Mhm.
everything, reboot, and then
Mhm.
start to gradually introduce those blocking agents again in a very gradual manner so that your body isn't as shocked. So there's some
Mhm.
women that can deal with it very quickly when you just block, but there's some women that can't. So you sometimes just need to take, the medical oncologist needs to take a step back because you don't want to just stop and cause someone to be, bedridden. So you
Mhm.
want to be able to reboot the system and start again. And it's okay to go back to your oncologist and say, I need a break. I can't take this.
Mhm.
This is your quality of life at the end of the day. Now we're
Mhm.
coming up to the end of the hour. I'm very conscious of time,
Okay.
but I think this is such an important question
Yeah.
from Lisander Paulo. I don't know if you're online and you want to be able to ask the question yourself, but it says, being an advocate, how can I manage emotional well-being while supporting patient and families? What strategies can I use to maintain professional boundaries and prevent burnout? I think it's such an important
Oh.
question. We were just discussing it earlier on.
Yes, we were. That's so, so important. So, the self-care, I think that person probably knows what the right self-care is for them, making and change it up. If for 10 years you've meditated or done this or that, change it up, do something new, something different, make sure your self-care is evolving. But the boundaries is a very sensitive place because most people who are in oncology, and I think most people would agree, when you go to the clinics, you're amazed at how nice everyone is and they really care. It's a self-selected profession. So that means you have a lot of empathy. So, and you're a good listener. But when you have empathy and are listening, you're feeling something too. Like I said, this one is breaking my heart to hear that. So, how can I all day long have my heart broken, feel sad, feel worried, feel, because I have to be mirroring and feeling in some way what someone's feeling to even be there with them and to really be there with them. There's some experience. So then there has to be a boundary in the sense that as much as I can agree, this is very difficult, very terrible, how you feel, I also have to convey to the patient, I believe you can do it. I see you as capable. So if I give into like, no, this is not, you're never going to make it. How could I possibly do that to someone? So I'm looking the whole time. What are her strengths? What are his ideas that have worked for him in the past? So you have to then put a boundary to some of that feeling. Don't go down to the ground with that person, but start to also lift them with seeing what is going well. What are the times when you felt well? It's your role to encourage as well. It's your role to build up that person as well. And then you have a light face, you're not overly burdened. It's okay to cry with the patient, but you come out of it. And at the end, you're light about it. You're more engendering more energy about it, but also courage about going back out into the world. I think that's so important. That boundary there is very important. And also, the worst thing you could do, I really mean this for someone you're taking care of, if you're in healthcare, is to give your patient the idea that they need you because they momentarily need you in moments, but they need autonomy. They need to be able to be there for themselves mostly, and you do too. So if you feel you need the patient, you've gone too far, you've gone
Yes.
over your boundaries, yeah. Because you shouldn't be drawing from them for your strength and for your ability or your happiness at all. So that's the most important boundary, and you got to check yourself all the time for that. So,
So Sarah Ibrahim has actually asked, made one comment and asked one question. I call her my little drama queen. We have this, actually, most of my little drama queens, and I absolutely love them. And she says, let's do a patient onboarding program. This is key to ensure readiness for initiating manage through and be ready to step in post-treatment phase with long-term side effects. Absolutely love it, Sarah. I'm going to call you up. We're going to start the patient onboarding program with you. But she also asks a very important question. Fibromyalgia and hormone blockers are not the best combination. So how can we manage? And we have quite a few women who've got fibromyalgia. We've got quite a few men who've got fibromyalgia, and that can sometimes be a real issue during chemo
oh.
treatment and during hormone blocking treatment. So what are the tools that they could potentially use to try and help with that?
Oh, yes. That combination is very, very difficult. I have several women I'm dealing with right now who have both. So even if they have found something that works for the fibromyalgia, whether it's medication or movement, another example where movement is necessary to overcome fibromyalgia. Now you're putting on all this extra inflammation, right? So anti-inflammatory products like ginger, turmeric, the essential oils like fish oil or borage oil, those, as long as those don't interfere with anything else the doctor is doing, because they are a little bit of blood thinning, because that's how they work. Using Zyflamin. Zyflamin is a product, but you could do this on your own where you use curcumin or turmeric and add a little rosemary to it. It makes it circulate around your body better. Get all the sugars out of your diet and go for all these anti-inflammatory products like dark green veggies, fish oils, olive oil. I think that's so important when you've got both happening. And don't worry. I think don't spend too much time trying to say, I think this is my fibromyalgia and I think this is my neuropathy. It really doesn't matter. It's a package, and it's a lot of stress trying to decide which one is which. Just go with the package and do everything you can to dampen that. And in your meditation, although I'll never find a shred of research evidence for this, target those symptoms when you're meditating. Think about dampening, the fire of the neuropathy or the pain you're feeling. Put that intention into your meditation. I think that works beautifully when you do that.
So thank you very much, Cynthia. This has been an awesome session as always. And if anybody would like to get in touch with Cynthia, I do have her email address, so I can share it with you. I hope you don't mind, Cynthia.
I don't mind at all. And I love being here with Dr. Shahina and all the patients that have the best questions and comments. It makes it so enjoyable.
Absolutely. I mean, the interaction has been tremendous. I know there's a lot more questions out there. I promise you, Cynthia has got this list of different topics she's going to address throughout the year. We're going to get her back. And I'd love to hear from everyone as to what they'd like to hear or
Mhm.
what they would like to discuss in the next session. And Cynthia, you did mention that perhaps we could think about doing group sessions for patients and their family members at some point. It's something that's innovative, and we'll certainly think about it. So
Yeah.
thank you all. Have a good night, and I know good morning at your end, Cynthia. And I hope to see you in the very near future. Hopefully, the next month we'll have probably another session of this. And again, I forgot to say this at the very beginning. Happy New Year.
Thank you. Well, thank
Thank
you,
you
everybody.
all.
Happy New
Thank
Year.
you. Thank you.